Now, for our next session, our live poster tour, I just want to remind everybody that we had a number of incredible posters submitted from Canadians working from coast to coast to coast. And somehow we had the unenviable task of narrowing it down to five, which was hard, but we found five incredible posters that were really excited to showcase. So here to moderate the poster tour is our own Bruce Squires, President of McMaster Children's Hospital and Vice President Women's and Children's Health at Hamilton Health Sciences. He's also the chair of the board here at Children's Healthcare Canada. So thank you so much, Bruce, for taking time out of your very busy schedule to help us moderate this event. And with that, in a moment, I'll share my screen and we can begin with our posters. And thank you so much.
Okay, thanks so much, Corey, and good afternoon, everyone. Welcome from coast to coast to coast to our poster session. I think this is a great way to finish off today's pop-up event, really learning lessons from pediatric immunizations and vaccinations for COVID-19. I want to thank you for joining us, and certainly thank you to everyone who put forward a poster to share kind of the learning and the quality improvement that you've made. I think as an organization, I'll speak here as the chair of the board, we're always really excited to showcase innovations happening in children's healthcare, and the posters hall sessions are a great way to do that. We're about to get direct presentations from five teams on the work they've done, but I'd encourage you all to visit on your own time the poster hall to browse all the submissions we had. Really, because we've showcased five, I want to get right to it. And our first presentation is going to be from Blossom Damaraj. Blossom completed her master's degree at the U of T, and she works as a clinical research manager in the Department of Complex Care, the Hospital for Sick Kids, with Dr. Julia Workin. She's working on several different studies focusing on studying and optimizing care delivery and health outcomes for children with medical complexity, as well as their families. And I think she shared that she enjoys working with patients and families and hoping to continue to study novel ways to improve care and supports for this unique population. So the title, as you see here, of Blossom's presentation is Accessible and Specialized COVID-19 Testing for Children and Youth with Medical Complexity. So with that, I'm going to turn it over to you, Blossom. Welcome.
Thank you, Dr. Squires, for that introduction, and good afternoon, everyone. As Dr. Squires mentioned, the title of my project is Accessible and Specialized COVID-19 Testing for Children and Youth with Medical Complexity. So as we know, COVID-19 testing for symptomatic individuals is a key public health measure in infection prevention and control. However, this can really be uncomfortable without appropriate supports and lead to testing hesitancy among certain populations, such as children with medical complexity and those with underlying neurological and respiratory conditions. So with that in mind, the Sick Kids COVID-19 testing program was developed as a specialized initiative for children with medical complexity and their families on site at Sick Kids to support a safe and accommodating testing environment for families. So multiple modalities of testing were involved and could be completed in the family's personal vehicle with specialized support from a nurse or child life if needed. So the objectives of our study were to investigate the characteristics of children with medical complexity and their families who underwent testing through our program and evaluate indications for testing and the overall experience that families had. So we had two parts to our study. The first was collecting prospective data on testing population characteristics, and the second was conducting semi-structured interviews with families who participated in testing. So what did we find? So 335 children and youth were tested in our program. All of them had a dedicated pediatric nurse, and all of them received testing in their personal vehicle. The majority of tests that were completed were nasopharyngeal swabs, and of our population, 88% had neurodevelopmental conditions and 12% were classified as children with medical complexity. We found a 6% positivity rate, and the most common reasons for testing were symptoms and exposure. So for the second part of our study, we interviewed 17 families who participated in testing, and we found three emerging themes. One was the benefits, and here we found that families really appreciated how accessible the testing was and that it was easy to access. They really liked the specialized support in that child life and nurses were available to really help calm down their child or hold their child and really support them during what can be an uncomfortable situation. It was very timely in that the experience was very fast, and they really appreciated the safety and that they could stay in their personal vehicle, didn't have to get out, and it was a familiar environment. Some challenges they mentioned were around booking, and some future suggestions would really be to continue the program and to expand our eligible population. In the words of one family, they mentioned how the program was a lifesaver for their son who was wheelchair bound and nonverbal, who could not get tested otherwise. Another family mentioned that at such a challenging time of immense stress, the program really allowed them to be safe and keep their families safe. So in conclusion, children with medical complexity and their families face unique barriers to COVID-19 testing. And through this specialized program, we are able to provide a unique opportunity for testing. Testing through nasopharyngeal swabs can be painful. We're really supported by this in-vehicle testing. And robust health and safety measures, including a coordinated testing approach, are really necessary to ensure that we have these accessible opportunities for children with medical complexity and their families. Finally, further research is just needed to be able to support this unique population. I would like to thank all the patients and families and the staff at the Sick Kids COVID-19 Assessment Center, and thank you all for your time and listening.
Oh, excellent. Thank you so much, Blossom, for that presentation. Folks, what we're going to try and do with, as time allows is I'm going to ask a quick follow-up question where possible to each of our presenters. But if there's time at the end, we're also going to take any questions you may have. So I'd encourage you to enter them in the chat, and we'll look to capture them later. Blossom, I'm going to ask you, as you've shared, suggestions for expansion of the program, and I think you spoke both to different patient populations, but also the possibility for different testing. So I wonder, on either of those two dimensions, do you want to share where you think the kind of the future opportunities would be? Where would you next go in sort of designing a study and a possible intervention?
Sure, that's a great question. So from interviewing families, they really mentioned that expanding the model first from a population perspective. So just with children with anxiety, those who have different phobias. So just making that more inclusive and more open, because a lot of children have these fears, even such things as needle phobia. But we actually did apply this model early on to expand it. And we now, we also offer a drive-through vaccine service. So that has been really helpful for a lot of families, and they really appreciated that as well. So just that drive-in vaccine service, and then just expanding it to different populations. I know one family actually mentioned if we could potentially do it for blood work. So we've brought that up with our supervisors and kind of discussing with families, could that be a possibility? But just, yeah, expanding it that way.
Excellent. Okay. Thank you so much, Blossom. So again, folks, encourage you, if you've got a question for Blossom or for any of our presenters, to enter those in the chat. Our next presenter is Leah Etier. Leah is a graduate of both the Bachelor of Science in Nursing and the Master of Nursing and Nurse Practitioner programs at Western in London, Ontario. Leah's clinical lead for the Pediatric COVID-19 Virtual Clinic. And in her practice, she sees a variety of general infectious disease patients, both at an inpatient and an outpatient basis. Additionally, she's the nurse practitioner representative for the congenital cytomegalovirus program for the Southwestern Ontario region. And she enjoys teaching and mentoring and has acted as a preceptor for various universities and works as a teaching assistant at Western. Title of Leah's poster is London Health Sciences Centre's Pediatric COVID-19 Vaccine Clinic, Overcoming Barriers for Vaccine Uptake in Children. Leah, welcome.
Okay, thank you. Thank you, Bruce, for the introduction. I'm excited to present our work from the Pediatric COVID-19 Vaccine Clinic run by the Children's Hospital at LHSC. So as many of you know, Health Canada approved COVID-19 vaccines for children aged 12 and older in May 2021, and for the 5 to 11 age group in November 2021. Initially, only mass vaccine clinics were available for children in London and surrounding area. And we know it is estimated that 33 to 63% of children and adults experience some needle fear or hesitancy, which results in about 5 to 10% of this group avoiding immunizations or painful procedures. So our clinic's aim was to develop a child-friendly clinic to support children with anxiety or needle phobia. or who may have other unique barriers to successful immunization at a mass vaccination clinic. So a nurse practitioner supervised immunization clinic was developed in collaboration with our local public health unit. The working group included nurse practitioners, child life specialists, nursing professional practice, clinical management, clinical risk and patient safety, and a family advisor. An accessibility assessment was also completed on our clinic space with feedback about flow and setup from someone with lived experience. And integral players of the clinic itself included registered practical nurses, child life specialists, pharmacists, and clerical support. The clinic began operation on August 10th, 2021. And with a successful implementation and stability of the clinic, NP presence was phased out and became RN-led. Infectious disease expertise was available on an as-needed basis for vaccine questions. The space was child-friendly, accessible, and provided private rooms for vaccination, which were low stimulation compared to mass immunization clinic models. Timing of clinic was selected to allow for attendance of families after work and school hours with allocation of extended appointment time intervals. So generally, patients were booked in 30-minute intervals, as opposed to the usual 5 to 10 minutes you'd get at a mass vaccination clinic. However, some of our children would require 45 minutes or even up to 2 hours for their appointment, and we were flexible and could accommodate that. Paramount to the clinic's success was the involvement of child life specialists. So not only were they able to provide one-to-one support to children while they were actually in our clinic, they also performed pre-screening phone calls, which allowed for assessment of psychosocial needs and optimizing care plans with parents in advance, which helped to increase child and family coping and comfort. Principles from the Comfort Promise were incorporated into the clinic as a strategy to address anxiety and maximize comfort. And other benefits of the clinic included availability of translation services, validated parking, anonymity that a mass vaccination clinic couldn't provide, readily available emergency care, familiarity of space for our existing LHSC pediatric patients. So at the peak of the clinic, when vaccines were in high demand, an average of 12 children were vaccinated weekly. Children rarely left the clinic unimmunized, but if they did, they were often successful at a subsequent visit. To date, 424 patients were scheduled for a first appointment, with an additional 93 having a repeat visit, demonstrating the success of the clinic and highlighting the need in our community. So looking to the future, based on parental and provider feedback, we're exploring to see if we can expand to offer other routine childhood vaccines. And additionally, we are actively working to being able to expand our clinic to the recently approved 6-month to 4-year age group. We also note it would be helpful in the future to obtain pre and post behavioral and emotional data to evaluate whether a clinic may help these children develop long-term coping skills to be successful with other vaccines and procedures in the future. So thank you very much.
Excellent. Thank you very much, Leah. Congratulations. Obviously, definitely some great learnings and an important service provided. So be interested in whether, as you did that evaluation, is there any, in addition to the measures you had in place, is there any changes that you would make to your setup and your structure that would even increase the success rate, and really the experience for your patients and families? Any conclusion you reached just now that, yeah, we'd add this differently?
Well, I think one thing that our group has talked about is we would like to be able to offer numbing cream and sucrose to our younger population, which is why we're having a little bit of a holdup for that age group. So we think that would really be great to increase comfort for that age population and decrease parental and child anxiety. So that's one of the things that we're working on right now. And then, as I mentioned as well, we would love to be able to expand to other vaccines as well, because we know these children who have anxiety, it's not just COVID vaccine related anxiety, they have anxiety about all needles, and often they're behind in their other childhood immunizations as well. So we would really like to expand to that group. And I guess the other thing that we haven't been doing great at so far is collecting really good data. So it would be helpful to get more data on the children that we're seeing so that we could evaluate that and see how possibly we can use that to better the clinic in the future as well.
Excellent. Thanks so much, Leah. So great. Really common observations around data collection and around this opportunity to expand these learnings, and some individual tips for the success of your program. Again, folks, I'll invite you to, if you've got questions for our presenters, including Leah, please enter them into the Q&A and chat. In the meantime, our next presenters are Anthony Daniel and Stuart Wong. Anthony has 12+ years as a pharmacist in various rehab, acute care, home care, and community settings. Over 10 years of experience in professional practice, and is currently the president of the Professional Practice Network of Ontario. And he wears very significant number of leadership hats. At Holland Bloorview, he's the collaborative practice leader, the interim manager of appointment services, and over the course of this pandemic, he's taken on roles managing COVID testing and screening, and is the co-lead of the hospital's vaccine strategy, as well as providing leadership at managing and organizing the clinics. Stuart Wong is an award-winning communicator with over 20 years of marketing, communications, fundraising, and strategic planning experience in the not-for-profit health sector. Stuart joined Holland Bloorview Kids Rehabilitation Hospital in 2015. He served as co-chair of the Pandemic Steering Committee, marshaling resources across the hospital to support client care, staff safety, and advocate for children's healthcare needs, and has also provided oversight of the hospital's vaccination strategy. So their poster is titled "Creating an Accessible and Welcoming Space to Vaccinate Children with Disabilities and Medical Complexity." I'll turn it over now to Anthony and Stuart.
Thanks very much, Bruce. We're thrilled to be here. Holland Bloorview Kids Rehabilitation Hospital is an institution in Toronto. We serve over 9,000 clients annually, and we provide inpatient and outpatient services for kids living with disabilities and medical complexity. When vaccines started rolling out in 2021, we sought to create a playbook to support the clients that we serve. We wanted to create something that was family-friendly, kid-friendly, and super accessible, so that the specialized population could have their vaccination needs met. So to do that, we did as we always do. We partnered with our families and we worked with our staff. We did a literature review. We looked at best practices so that we could establish a playbook that we would execute in partnership with Toronto Public Health, who had reached out to us about having these clinics to support the specialized population. So Toronto Public Health was going to provide the vaccine and the vaccinators, and Holland Bloorview was responsible for providing the environment, which is what Anthony will talk to us about.
So from all the presentations I've heard so far, it sounds like we all had the same recipe to making a successful clinic for these kids with medical complexities. Like Stuart said, one of our big differences was we looked at public health as in their expertise in vaccinating people, and then we used our expertise in terms of what we do with behavior and keeping and helping kids with anxiety and fears. Some of the things similar to what everybody did in terms of accessibility, we had parents could put in their accommodation needs in advance of the clinic. So we had a sign up tool called Pick a Time. They let us know their needs. It could help, and it helped us use our clinical staff to prepare in advance to manage the kids. We had clear masks available. We had translation available, clear signage. We want to make it as easy as possible for when people come to the clinic. They wouldn't have any barriers. So free parking, if there was any disabilities, we also try to gather any of those feedback from surveys so that we would be prepared for future clinics in terms of any accessibility needs. We created a child-friendly environment. We had videos playing, coloring books, video games. In terms of some of what people told us before, some kids needed up to 1 hour to get vaccinated. One of the things that we did at first was we were trying to put time limits on the vaccinations because we're like, okay, if they exceed a certain amount of time, their time is going to expire and they won't actually receive the vaccination. What we learned later on was, no, they need to sit through these vaccines and they need that time to just be ready to get vaccinated. A cool thing, as you can see on our poster, we used communicative disorder assistants and speech language pathologists to create a social story. We use the social story in advance. We email it out to families to get them prepared and know what to expect when they came to a vaccine clinic. We had them printed out throughout our clinic as well. Easy signups, we used our schools, we used our different hospital partners to send out the messaging in terms of sign up to the clinic and for advertising. Our resources, we used four different types of clinicians: early childhood educators, child life specialists, child and youth workers, and behavioral therapists. Quiet rooms were definitely necessary for kids with any behavioral needs or sensory needs. We had good communication and pre-huddles with our Toronto Public Health staff. And like I said, we had a follow-up where we got feedback to make upgrades or changes to our clinics in the future. Stuart, I'll pass it back to you.
Yeah, and just to kind of conclude, so far we've had 16 on-site accessible, family-friendly, child-friendly vaccine clinics. We've provided over 1,000 vaccinations, and we're still going. We just had one last week. And as the rules, the eligibility keeps changing, we're seeing an increase in the demand. So I think we had 73 at our clinic. So we're going to keep running these until the demand tells us otherwise. So we're really proud of the service. We continue to do evaluation as well. We send out post-event surveys, and we hope that this work, and thank you to the organizations for putting this on to allow us to and to share all the knowledge that we have so that this can happen more and more in the community. Thanks, Bruce.
Excellent. Thanks very much, Anthony and Stuart. And again, congratulations, over 1,000 children vaccinated. That's just awesome. You mentioned certainly a key part of this being communication out into the community, including social. So any key observations you'd share with folks around what were the most important messages for families in those early communications to I guess to promote confidence and really sign up and taking advantage of the clinic?
The environment sets a tone for the clinic. You want to make it as friendly as possible. So because kids are walking in with a lot of anxieties and fears. So ease or calm. Quiet spaces are essential to these types of clinics. You can't have any fixed times. You need some sort of distraction to help, different types of distractions for different age groups. And then the other thing I would say is just strategies that you typically use with vaccines. Hide the needle. If kids need a little bit more support or security, let them hold on to their favorite toy or whatever it is. Anything to add, Stuart?
Yeah, no, I think you've outlined all the clear kind of features of the clinic, and that's what we work to communicate in kind of bullet point form and all of our social media and working with our partners. We have a school on site, so we had the students from the school who were vaccinated, and they would also network with the other kind of similar community agencies in the area. We sent out communications through our family networks to communicate that these clinics were available and had specialized features that were not available in mass vaccination clinics.
Excellent. Okay, thanks very much. And I think a key observation for folks is, again, as we're thinking forward. So thank you to Anthony and Stuart. So our next presenter is a group of presenters, Darlene Aldred, Kirsten Harris, and Natalie Murphy. Together, they have over 30 years of combined experience working with pediatric populations. And the title of their poster is "Practice Supports Can Bridge a Knowledge Gap to Enable Non-Pediatric Immunizers to Provide Developmentally Appropriate Trauma-Informed Care to Children and Youth." So really pleased to welcome Darlene, Kristen, and Natalie. Over to you.
Hello, thank you for that introduction. I think these two are being kind as well, over 30, but thank you for the opportunity to share our experience supporting non-pediatric immunizers to provide care to children and youth. We're joining today from Surrey, British Columbia, and would like to acknowledge that Fraser Health provides services within the traditional, ancestral, and unceded territories of the Coast Salish and Nlaka'pamux nations, which is home to 6 Métis chartered communities. My name is Darlene Aldred. As a leader in professional practice, I led immunizer orientation strategy for the COVID-19 vaccination campaign. I'm joined by Natalie Murphy, who was a communicable disease nurse coordinator for population public health, then transitioned to a nursing practice consultant role during the COVID-19 immunization campaign, and Kirsten Harris, a clinical practice consultant who had a significant role in implementing the immunizer orientation strategy. So Natalie and Kirsten will briefly outline what we did to successfully support staff who did not have experience with immunizing the pediatric population in our mass immunization clinics.
Thanks, Darlene. So for some context, Fraser Health provides service to 1.8 million people, which is almost half of the population of British Columbia. So while planning for the child and youth COVID-19 vaccine rollout, pediatric-specific clinics to meet the nuanced practice of this population were considered. However, the constraints imposed on us by the pandemic, full ICUs, ongoing staffing crises, and large populations with varying COVID-19 vaccine eligibility needs led to the decision that the children and youth needed to receive COVID-19 vaccine in the pre-existing adult mass clinic settings. These clinics were staffed with predominantly adult-focused immunizers, so the goals were to prepare the immunizers to provide best practice for the pediatric population and for patients and families to have a positive and safe immunization experience. Given that Fraser Health is a large health authority, relevant expertise was spread out amongst different programs and departments. The unique pandemic structures and priorities facilitated connections between the clinics, professional practice, population public health, maternal, infant, child and youth program, employee experience, and operational leadership. Extraordinary collaboration happened within short timelines, which fostered strategies to anticipate and address non-pediatric immunizer practice.
Early information for the pediatric population was presented to 2 different target audiences, the clinic leadership and immunizers. A presentation was developed to introduce clinic leadership to guiding principles, including trauma-informed care for the pediatric population. Immunizers were supported through practice bulletins and in-services that outlined strategies for managing pain, anxiety, and the use of distraction techniques. These foundational pediatric concepts were novel to both the clinic leadership and adult immunizers. Clinics relayed information weekly to professional practice, and practice supports were created in response to the issues that arose in the clinics. For example, a practice bulletin focused on clear identification of epinephrine dosing for the child and youth populations. This served as a quick reference guide for the immunizers to ensure correct, age-appropriate anaphylaxis management. Another example was an instance of pediatric patient receiving an adult dose of vaccine. A bulletin was created to prevent future medication errors. All of our practice supports and patient and family testimonials can be found using the QR code on the poster. Please do have a look. Thank you for the opportunity to share a glimpse into our experience.
Wonderful. Thank you so much, and congratulations on that success. And really important to be presenting a different approach that really fits into a max vaccination clinic. So that wealth of practice supports that you've developed, have you had any opportunity to get some more feedback around the actual adoption and use of those, both kind of in this context and going forward?
Mm-hmm. So we have been in contact with the clinics, and we heard that there was focus groups from the clinics that really, took into account what we provided in terms of practice supports, and we got some feedback that those focus groups were used to sort of focus improvements or to reinforce the practice from the immunizer perspective, which was great to hear. We also know that there was some PDSA cycles that we partook in with the clinics on that feedback, and incorporating that feedback in sort of real time into the useful tools that the clinics were using. So in services that were provided, practice bulletin content like we talked about, and things like communication tools like huddle tools to be used in the clinic settings to share that information. We found out that as the partnership really shifted in response to the clinic needs, it became apparent that a transition strategy was important to support clinics to take the ownership of the creation of those practice supports. And we were still getting lots of emails and sort of communication from the clinic. And that was kind of evident to us that those practice bulletins and supports were really being used by the clinics, which was great. And then what we also found was that the real-time patient experience survey feedback that we were encouraging patients and families to provide, that was given back to the clinics, and it really helped to increase the confidence, encourage best practice, and really strengthen those pediatric immunization competencies that we were providing, I guess, in the practice supports. So yeah.
Sorry, I was on mute there. Excellent. Thank you very much. Congratulations again on that success. So we're going to move to our next poster, and our presenter here is Anya Saladievich. I don't have unfortunately further background with respect to Anya, but the title of the poster presentation is the Island Vaccine Support Program, COVID-19 Vaccine Literacy Intervention in Prince Edward Island. So I'm going to turn it to Anya.
Thank you so much, Bruce. I appreciate it. So my name is Anya Saladievich, and today I will be presenting on behalf of Dr. Kate Kelly, who was unable to make it. And my background's in health promotion and education. So hi, everyone. Today I'm presenting an overview of the Island Vaccine Support Program, a province-wide program that aims to improve knowledge and perception of the COVID-19 vaccine among families in Prince Edward Island. So this program represents the final stages of a multi-phase approach that began with a scoping review of existing vaccine support programs in Canada and a review of the factors associated with vaccine hesitancy. Phase 2 consisted of a province-wide survey of the attitudes and beliefs of islanders related to the COVID-19 vaccine and immunization program. This survey was conducted in spring 2022 and received just over 1,400 responses. These two phases informed the development of the program, which included several approaches to capacity building within our partnership organization, the Chances Family Center. This community-based charitable organization provides programming and support to island families across the province. Chances programming broadly consists of home visiting initiative called the Best Start program, as well as group parenting sessions that span pre and postnatal topics. Materials for our program were curated from evidence-based sources, including Health Canada and the World Health Organization. These materials were organized into resource binders that were provided to all of the Best Start workers and facilitators and are continuously updated with the information as it comes out. These binders provide the curriculum for our program and provide current information about the COVID-19 vaccine to those delivering the program. Best Start workers and the Chances Group facilitators deliver the Island Vaccine Support Program to island families using motivational interviewing. MI is discussion-based and person-centered approach to behavior modification. All Best Start workers and facilitators received MI training and cultural inclusion training in preparation for this program. The program launched in September 2022, September 1st, and will run until January 2023. Data collection consists of pre and post surveys that evaluate knowledge related to the COVID-19 vaccine and ongoing immunization program. Those delivering the program will also provide reports describing their experience with each participant. The project unfolds in the Best Start program across 3 visits. In the first, clients are provided with the recruitment cards to the study that include like a QR code and a mobile number to contact a Chances representative. Clients can then opt into the study and participate using electronic or paper-based documents to ensure accessibility. Appropriate translations of these documents are also available. Clients that sign up for the program are engaged by the Best Start worker in the second visit to complete the pre-survey and participate in a discussion about the vaccine. This is an informal discussion led by the Best Start worker that provides an opportunity for the participant to talk about the vaccine in a respectful, non-judgmental environment. Handouts on topics of interest are left with the participant at the end of the session. Finally, the participant is asked to complete the exit survey at the third and final visit. Our program will also be delivered through Chances group parenting sessions. This process will be similar to the one outlined in the Best Start program, but rather than a client-led discussion, program materials will be integrated into relevant sessions during existing programming. Participants in these sessions are asked to complete the pre and post surveys electronically. This program will conclude in winter 2023. We expect the participation in the program may lead to an improvement in vaccine literacy. Other outcomes of interest will include how the two methods of information dissemination, specifically between the in-home one-on-one sessions and the large group sessions, impact knowledge uptake. Knowledge generated from this project will be used to inform future interventions that aim to support informed decisions about childhood immunization. Thank you.
Oh, thank you very much, Anya. Really, really exciting program. And noting that that you've kind of ensured that you're addressing both COVID-19 vaccine literacy, but also vaccine literacy in general. So maybe just ask you a question about that, the extent to which you felt in the communication materials that you need to address the two or perhaps more situations separately, or most of the message is sort of meta and consistent across all immunizations.
The reason why we chose to go with, say that again, Bruce?
So really asking you, because I think if I understood you correctly, you are going to be addressing both COVID-19 vaccine literacy, but also vaccination literacy in general in the same intervention. So if I have that correctly, to how much, to what extent are they two separate pieces of messaging, or are they all the same messaging?
I believe they're all the same messaging, but obviously I'm just here to kind of take over Dr. Kate Kelly. I wish she was here to kind of answer that question a bit more, but I believe it's all kind of together, but mostly focusing on COVID-19. Yeah.
Thanks very much, Anya.
Yeah.
And I want to take this chance to thank all of our presenters for a really great session of posters. We're bringing them back onto screen now, so to provide and encourage an opportunity for you, the audience, to pose any questions to any of our individuals or to the collective. I want to put that call out. I am going to maybe give you an opportunity to think about whether you have any additional questions or comments for the group. But I want to focus on that last piece and ask folks to share, for you, the extent to which what we've learned here is going to support and drive immunization and vaccination for children and youth overall and going forward. Any key thoughts on how we ensure that any momentum and learning that you've captured in terms of COVID-19 vaccination is applicable and is actually applied to future vaccination programs? Anthony.
I would say the key thing is, especially for these specialized populations, we need to have separate sites. We can't have them done in mass vaccination centers. They won't work for these kids.
Yeah, really speaking to medical complexity. And so a pretty obvious follow-up to that, Anthony, of course, is how do we make that possible in in parts of Canada that don't have, for example, a specialized children's hospital with the physical and the human resources, and maybe our folks from Fraser Health will have some thoughts on that.
Yeah, thank you. I think for us, it was really leaning on our partners that were experts in the various aspects of vaccine delivery and collaboration that we had never experienced before in Fraser Health. So it really allowed us to see the value in sort of coming together and really working towards a common goal. So I think for us, we didn't have that ability. So we utilized what we had, and it came together wonderfully. And I think we had really good working relationships, and we came alongside the clinic staff and leadership to understand how we could help support what they needed in the clinics. And so again, I think that was sort of our reality, and we managed to successfully do that with the extraordinary collaboration that occurred with the various partners in our health authority.
And you really focused on processes to support knowledge translation and adoption, didn't you?
Yes, absolutely.
Okay. Any thoughts on any of those pieces from other presenters? Yeah, Leah.
So part of our group, our working group who created our clinic, we were also we were consulted by the local public health unit to also give them tips on how to make their mass vaccine clinics a bit more child friendly, kind of like what Fraser Health did. And we found that they were pretty receptive to our feedback, and they invited us to a bunch of their meetings when they were setting up their clinic space. And we gave feedback on what we thought would work well and what wasn't working well for them. So perhaps that's an opportunity to help engage the smaller units who may not have the same capacity to do a specialized clinic like we did at our center, being a larger center. So something to think about.
Absolutely, thank you, Leah. Certainly in Hamilton Public Health here, where we are at McMaster Children's Hospital, there's been such a pull for that knowledge and education and support to drive improvement, particularly again in the childhood vaccination clinics that they're operating. So hearing that that is an additional component to effectively vaccinating our populations. So folks, want to give a huge shout out again and thanks to our presenters and these 5 posters. They are, in answer to the question, they are available on the Children's Healthcare Canada website for downloading and use. And I think I will ask Emily to speak to, but I believe those will continue to be available on an ongoing basis. I'm going to now say again a thank you to everyone for your participation and in your engagement in this poster session and in all of today's events.